Have you ever brushed off a small change in your body because you thought it was just aging? Maybe you noticed light spotting after many years without a period, or perhaps you felt a new cramp in your lower belly and dismissed it as something ordinary. For women over 50, it's so easy to assume that unusual symptoms are part of the natural process of getting older. But sometimes these small signals are actually your body's way of whispering that something important needs your attention. When it comes to gynecologic cancers, such as ovarian, uterine, cervical, or vulvar cancer, early signs are often subtle. They can be overlooked, ignored, or misunderstood. Yet the reality is that catching these cancers early can save lives. Hello, I'm Dr. Lisa Perriera. For more than 30 years, I've cared for women at every stage of life. I've seen firsthand how awareness and early action can make a tremendous difference in health outcomes. My mission here today is simple. I want to walk you through 7 early warning signs of gynecologic cancer that women over 50 must not ignore. By the end of this video, my hope is that you'll feel more informed, more confident, and more empowered to take control of your health. Knowledge is one of the greatest gifts we can give ourselves and those we love. Before we dive in, I'd like to invite you to subscribe to this channel. Here at Elder Care Wellness, we create content that is medically trustworthy, evidence-based, and specifically designed for women like you. We talk about real issues that affect your health, and we do it in a way that's clear and compassionate. And I'd love for you to join the conversation. If you've ever noticed a change in your body and wondered whether it was normal, leave a comment below. I'd truly value hearing your story. Sometimes the experiences you share can help another woman recognize something in herself. So let's begin with the very first sign, abnormal vaginal bleeding. If you're already postmenopausal, meaning you haven't had a period for at least 12 months, then any vaginal bleeding is not normal. This includes even the lightest spotting. The American College of Obstetricians and Gynecologists emphasizes that bleeding after menopause should always be evaluated by a healthcare provider. While there can be non-cancerous causes, such as thinning of the vaginal walls, or benign growths like polyps, postmenopausal bleeding can also be an early sign of endometrial uterine cancer, or less commonly, cervical cancer. For women who are still transitioning through menopause, abnormal bleeding might look a little different. Maybe you've noticed heavier than usual periods, bleeding between periods, or menstrual cycles that are suddenly irregular after years of predictability. While hormone fluctuations are common in perimenopause, significant changes in bleeding patterns should never be ignored. Think of your uterus as a reliable clock. If that clock suddenly starts ringing at odd times or chiming much louder than before, that's your body's way of telling you something needs attention. One of my patients, whom I'll call Anna, taught me an unforgettable lesson. She was 61 and had been postmenopausal for nearly a decade when she noticed a few drops of blood on her underwear. She almost ignored it, chalking it up to dryness, but she decided to mention it during her annual wellness exam. That decision quite literally saved her life. The bleeding turned out to be caused by early-stage endometrial cancer. Because Anna sought care right away, her treatment was straightforward and her outlook was excellent. Today, she's healthy and grateful she didn't dismiss that tiny inconvenience. The key takeaway here is simple. If you ever notice unexpected bleeding, spotting, or discharge after menopause, don't assume it's nothing. Your body is giving you valuable information. Many women hesitate, thinking they're overreacting, or they hope the problem will disappear on its own. But when it comes to your health, speaking up is never an overreaction, it's a form of self-respect. Early diagnosis often means less invasive treatment, fewer complications, and far better outcomes. So listen to that signal. Trust your instincts. And remember, you are your body's best advocate. Now that we've talked about abnormal bleeding, let's move on to another symptom that often slips under the radar: persistent bloating or abdominal swelling. Bloating is something most women are familiar with. Maybe it comes after a salty meal, a glass of sparkling water, or when digestion feels sluggish. In those cases, bloating usually passes within a day or two. But when bloating becomes frequent, lasts for weeks, or keeps getting worse, it's time to pay attention. The American Cancer Society notes that women with ovarian cancer often describe their earliest symptom as a sense of fullness or tightness in the abdomen. What makes it concerning is its persistence. If your waistband feels snug, even though you haven't gained weight, or you feel uncomfortably full after just a small meal, don't dismiss it as just age or just slowing metabolism. To picture this, imagine your abdomen as a balloon. Ordinary bloating is like air: you release it, and the balloon goes back to normal. But with ovarian cancer, fluid can build up in the belly, and the balloon stays stretched no matter what you do. One of my patients, Mary, noticed this kind of bloating. She told me, "Doctor, I just feel puffy all the time." She assumed it was menopause weight gain. But when her symptoms persisted, she sought care. Tests revealed an ovarian tumor causing fluid accumulation. Because Mary listened to her body and came in early, we were able to intervene before the disease advanced. The next sign I want you to watch for is pelvic or abdominal pain that doesn't go away. Pain is a complicated signal because many of us are used to aches and cramps. You may have lived through decades of menstrual discomfort, or you may have arthritis or back pain now. But pain from gynecologic cancers is different. It often lingers, feels deeper, and doesn't respond well to simple remedies. According to the Mayo Clinic, ovarian and uterine cancers can create pressure inflammation or even nerve irritation that shows up as ongoing pain in the pelvis or lower belly. Now, not all pain is dangerous. Sometimes it's caused by benign conditions like fibroids, digestive issues, or even constipation. The difference is in duration and intensity. Occasional cramps that ease with rest are usually not a red flag. But if you notice pain that lasts more than 2 weeks, grows worse, or interferes with your daily life, it's like a smoke alarm that won't stop ringing. You may not see the fire, but you should never ignore the alarm. Alongside pain, another early clue is changes in urinary habits. Many women over 50 expect bladder changes. You may find yourself leaking a little when you laugh or cough, or needing to get up at night more often. These are common, especially after menopause. But sudden, unexplained urinary changes, such as feeling the urge to go, constantly having pain when you urinate, or noticing pressure that makes you rush to the restroom, can sometimes be linked to gynecologic cancers. The National Cancer Institute explains that tumors in the pelvis can press against the bladder, making you feel like you need to go even when it isn't full. Think about your bladder as a small water tank. Normally, it fills and empties on a predictable schedule. But if something presses against the tank, it may trigger a false alarm again and again. If you suddenly find yourself planning errands around bathroom access or waking up multiple times at night despite not drinking more fluids, it's time to check in with your doctor. While urinary tract infections are the most common culprit when symptoms persist, further evaluation is necessary to rule out something more serious. What ties these 3 signs, bloating, pelvic pain, and urinary changes, together is that they are easy to dismiss. Many women assume they're simply part of aging or menopause. But I encourage you to think of these symptoms as your dashboard warning lights. They don't necessarily mean there's a major problem, but they should never be ignored. When you catch issues early, you give yourself the best chance for simple treatment and a strong recovery. To summarize, persistent bloating, chronic pelvic pain, and significant urinary changes are not just inconveniences. They are your body's way of saying, "Please pay attention." Listening to these signals can make the difference between finding a cancer early when it's most treatable and finding it too late, Remember, your health is precious, and you deserve to feel strong, confident, and safe in your own body. We've already looked at abnormal bleeding, bloating, pelvic pain, and urinary changes. The fifth warning sign that deserves your attention is changes in bowel habits. Occasional constipation or diarrhea is common. Maybe you ate something unusual, or your medications upset your stomach. But if you notice a new persistent change, such as constipation that lasts for weeks, diarrhea that won't resolve, or stools that look different in size or consistency, it could be your body signaling something more serious. The National Cancer Institute notes that ovarian and uterine cancers can press on the intestines, causing blockages or irritation that show up as altered bowel patterns. Think of your digestive system as a carefully wound clock. Normally, it ticks along with steady rhythm. But when something presses against the gears, the hands may speed up, slow down, or stop altogether. That's why a sudden shift in how often you go or how easy it feels deserves attention. One patient of mine, Carol, struggled with constipation she thought was due to stress. But after several weeks without improvement, she came in for evaluation. Imaging revealed a pelvic mass pressing against her colon. Because she spoke up, we were able to treat her early. Closely linked to this is the sixth sign, unexplained weight loss or loss of appetite. Many women over 50 work hard to maintain a healthy weight, and some are pleased when the scale drops without extra effort. But weight loss that happens without dietary changes or exercise should always be investigated. According to the American Cancer Society, ovarian cancer often causes a feeling of early satiety, meaning you feel full quickly even after a small meal. This happens when tumors or fluid buildup press against the stomach. Imagine your stomach as a grocery bag. Normally it has plenty of room for a full meal, but if you put a heavy box inside that bag, even a few apples will make it feel full. That's what happens when disease takes up space in the abdomen. One of my patients, Susan, was thrilled to see 10 pounds melt away without dieting. But when her appetite vanished and she constantly felt fatigued, she realized something wasn't right. Tests confirmed early-stage ovarian cancer. Because she didn't ignore her symptoms, her treatment was highly successful. Finally, let's talk about the seventh sign, persistent fatigue. Fatigue is one of the most common complaints I hear from women over 50. And it makes sense between family responsibilities, changes in sleep, and the natural aging process. Tiredness is familiar. But cancer-related fatigue is different. It doesn't improve with rest. It lingers, making even small tasks feel overwhelming. The National Cancer Institute explains that tumors can drain energy by altering metabolism, lowering blood counts, or triggering inflammation. Think about your body like a smartphone battery. Normally you recharge at night and wake up at 100%. But with cancer-related fatigue, it's as if the battery never charges beyond 30%, no matter how long it stays plugged in. If you find yourself skipping activities you once enjoyed, or struggling to get through everyday routines despite adequate rest, it's worth asking your doctor to look deeper. Now it's important to stress that these symptoms, bowel changes, weight loss, loss of appetite and fatigue, don't always point to cancer. They can be caused by digestive disorders, thyroid issues, depression, or even side effects of medications. What matters is persistence and change from your personal baseline. You know your body better than anyone else. If something feels different and won't go away, that's your cue to seek medical advice. By now, we've covered all 7 warning signs: abnormal, bleeding, bloating, pelvic pain, urinary changes, bowel changes, unexplained weight loss or appetite loss, and persistent fatigue. On their own, they might seem ordinary. But together, or when they last longer than expected, they form a pattern that shouldn't be ignored. Remember, your body is like a trusted friend. It will always try to tell you when something isn't right. The key is listening and taking action, before small whispers become urgent cries. When you look at these 7 warning signs together, abnormal bleeding, bloating, pelvic pain, urinary changes, bowel changes, appetite or weight loss, and persistent fatigue, it can feel like a long list. You may even wonder, how do I tell the difference between normal aging and something serious? That question is both common and important. The truth is, many of these symptoms can overlap with menopause, digestive issues, or even stress. But what makes them different in the context of gynecologic cancer is their persistence, newness, and how much they interfere with your daily life. Your body has a language, and symptoms are its words. At first, they may sound like whispers, easy to overlook or brush aside. But if those whispers continue day after day, they become louder, asking you to listen. Think of it like a car's warning light. You might ignore it for a short drive, but if it stays on every time you start the car, you know it's time to check the engine. The same is true for your health. So what should you do if you recognize one or more of these warning signs in yourself? The first and most important step is to schedule an appointment with your doctor. Be clear and specific about what you've noticed. For example, instead of saying I'm tired, you might say I've felt exhausted every day for the past month, even after getting 7 hours of sleep. This kind of detail helps your doctor understand whether further evaluation, such as blood tests, imaging, or a referral to a gynecologic oncologist, is necessary. The second step is to trust your instincts. Many women hesitate to bring up symptoms because they don't want to seem overly cautious. Others may be told, it's probably nothing. While it may indeed be nothing serious, it is always your right to seek answers. Getting a second opinion is not being difficult, it's being proactive. The Mayo Clinic reminds patients that persistence in advocating for your health often leads to earlier diagnoses and better outcomes. The third step is to keep track of your symptoms. Write them down in a notebook or a phone app. Record when they began, how often they occur, and whether they're getting worse. This simple act of logging your experiences gives both you and your doctor a clearer picture. It can also help you feel more in control, reducing the anxiety that comes with uncertainty. It's also worth remembering that awareness is not about living in fear, it's about living with confidence. When you know what to watch for, you don't have to second-guess every small change. Instead, you can recognize patterns and make informed choices. Knowledge is like a flashlight in a dark room. It doesn't change the furniture, but it helps you see clearly so you can move safely. Finally, let's talk about the power of sharing. Too many women suffer in silence, thinking their symptoms are just part of getting older. But when you share what you've experienced, whether with friends, sisters, or even daughters, you create a ripple effect of awareness. Sometimes hearing another woman's story is exactly what prompts someone to seek care. In fact, I'd love for you to reflect on this. Have you ever noticed one of these symptoms and wondered if it was normal? By talking about it openly, you may help another woman recognize her own warning signs sooner. We've now walked through all 7 early warning signs of gynecologic cancer that women over 50 must not ignore. 1. Abnormal vaginal bleeding. 2. Persistent bloating or abdominal swelling. 3. Pelvic or abdominal pain that doesn't go away. 4. Changes in urinary habits. 5. Changes in bowel habits. 6. Unexplained weight loss or loss of appetite. 7. Persistent fatigue. On their own, each of these symptoms can seem harmless or connected to everyday life. But when they appear suddenly, last longer than a few weeks, or feel different from what you've known before, they become meaningful signals. By listening to those signals, you give yourself the greatest gift, an opportunity for early detection when treatment is most effective and outcomes are far more hopeful. According to the National Cancer Institute Catching Gynecologic Cancers, Early significantly improves survival rates and often means less aggressive therapies. That is why your awareness matters so deeply. I want you to carry this knowledge with a sense of empowerment, not fear. Your body is not your enemy, it is your partner, your lifelong companion. Think of it as a trusted friend who has walked with you through every stage of life. That friend communicates with you through whispers, nudges, and sometimes louder shouts. When you notice a change, it's not a betrayal, it's a message. And the most loving thing you can do for yourself is to listen and respond. Over the years, I've seen countless women protect their health simply by trusting their instincts. One woman noticed spotting after menopause and mentioned it to her doctor. She caught uterine cancer at its earliest stage. Another felt bloated for weeks and decided to ask for a scan. She found an ovarian tumor before it spread. Their stories remind us that vigilance doesn't mean living in worry, it means living in awareness. Awareness opens doors to early care, to less invasive treatments, and to more years of healthy living. So what should you do moving forward? Keep these 7 signs in mind. Pay attention to your baseline, how your body usually feels, and notice when something shifts. Write down your symptoms, even if they seem small. Speak up at your doctor's appointments, and don't hesitate to ask for clarity or second opinions. These steps aren't just medical. They're acts of self-care, of honoring the life you've built and the people who love you. As we close, I want to leave you with this reflection. Every stage of life brings new challenges, but also new opportunities to protect and strengthen your health. By being attentive and proactive, you not only safeguard your own future, you also inspire the women around you, your sisters, your friends, your daughters, to do the same. Together, we create a culture where women listen to their bodies and trust their instincts. If this video has given you something valuable today, I encourage you to share it with another woman in your life. You never know whose story it might change. And if you'd like to stay connected, make sure you subscribe to this channel. We'll continue to bring you trusted, evidence-based health guidance designed especially for women over 50. Finally, I'd love to hear from you. Which of the 7 signs surprised you most? Leave a comment below, because your voice and your story matter. Remember this: your health is precious, your instincts are powerful, and your future is worth protecting. Together, by listening to our bodies and supporting one another, we can face the years ahead with strength, clarity, and confidence.